Hi, my name is Lauren. This is Erica. We're doing a video Symbicort through a holding chamber.
The patient's name is Lauren Rabideau. Her date of birth is 11/22/94. She is 5'3" and weighs 125 pounds. She was admitted on 11/16/15 with a diagnosis of shortness of breath. The patient has a history of frequent asthma episodes. She is a non-smoker. Her home medications include albuterol MDI as needed, and she is allergic to milk, penicillin, and pollen. Ms. Rabideau arrived at the urgent care facility around 10 this morning. Her friend that brought her to the facility explained to the medical staff that Lauren was feeling extremely short of breath this morning. She took 2 puffs of her albuterol inhaler and received little relief. She used her peak flow meter after the 2 puffs of albuterol and received a score of 180. 180 is about 60% of her usual peak flow of 450, which puts her in the yellow zone between 50 and 80%. After seeing her score of the peak flow meter, she wanted to be cautious in case her peak flow worsened and asked her roommate to drive her to urgent care. The patient followed the usual protocol for her peak flow meter, which states when her peak flow is in the yellow zone, she will be careful and has the option to seek medical attention. The patient states that she feels short of breath and would like to be prescribed a medication that will help manage her asthma symptoms. A patient exam was performed upon arrival. The patient is awake and oriented. Her heart rate is 115 beats per minute. Her respirations are 28 a minute. Her SpO2 levels are 92%. Her blood pressure is 120/75, and her lung sound contains slight crackles over lower lung fields, and she is coughing up small amounts of thick white mucus. The patient's ABGs revealed a pH of 7.37, a PaCO2 of 42, an HCO3 of 22, a base excess of +2, a PaO2 of 88, and an SaO2 of 92. Based off of the patient assessment, the doctor has ordered 2 puffs of Symbicort with a spacer. Some indications for Symbicort include improvements of lung function and symptom control, management of asthma, and reduces inflammation. Some hazards include thrush, hoarseness, voice changes, cough, and wheezing. Symbicort can be used to treat cases of severe and persistent asthma and to relieve symptoms from COPD. Unfavorable responses to Symbicort include reactions to the corticosteroids. Favorable responses are management of asthma, relieving symptoms and exacerbations of COPD, and contraindications can include hypersensitivity, and it cannot be used for an asthma attack. Hi, my name is Erica, and I am an MVC respiratory care student, and I am here to deliver the treatment that your doctor has ordered for you. Can you tell me your name and birthday?
Lauren Rabideau, 11/22/94.
I see a bracelet. Perfect. Okay, Lauren, I'm just going to check your vital signs, okay?
Okay.
Just going to need a finger from you to do this. Okay. Okay. All right. Now, Lauren, I'm just going to listen to your lungs. If you could sit forward for me.
Okay.
And I need you to take in deep breaths through your mouth.
Okay.
Ready?
Mm-hmm.
Go ahead. Okay, now I'm going to come around the front. Deep breath for me.
Ever since I've been ignoring her, she's been so nice to me. And I'm like, she's always rude and bitch to me all the time, and I'm like, that her to make her cry.
Last
Always
one.
back
Good. This This is your Symbicort inhaler, and this is your spacer, and these two are going to be used together for your treatment.
With this medication, can I take it during an asthma attack?
No, this is a long-acting drug for the maintenance of your asthma.
Okay, thank you.
What you're going to do is you're going to give your inhaler a couple of shakes. You're going to pop the cap off, and when it's new, you have to prime it. So you're just going to let off a puff, and then you're going to take your alcohol wipe. You want to make sure it's clean, and you're going to wipe off the boot, and you're going to wipe off the spacer, and you're going to attach it like this. Okay, now that I've showed you how to set it up, I'm going to kind of walk you through how to use it. You are going to make sure your mouth is closed tightly around the mouthpiece, and you are going to administer yourself a puff. You're going to take a slow, deep breath and hold it for 10 seconds, preferably, but you can hold it as long as you can. You ready to try it?
Yeah.
Okay, here you go.
Do it on Tuesday.
Yep, deep breath in. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. Thank you. Now, before you administer your second puff, you need to shake it. Okay?
When we're ready, I can go?
Go ahead. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Go ahead and let it out. Good. Very good. Now that we've done your treatment, there's a couple things I gotta have you do. I'm gonna need you to cough for me.
Okay.
And now I'm gonna need you to rinse out your mouth after using a corticosteroid to prevent thrush. Okay. Very good. Now the last thing before I go is I gotta check your vitals again.
Alright.
Okay?
You feel like all that you guys on one sheet, all your details on one sheet.
Can I just see your finger?
Well, I knew it was gonna be you. Okay, I'll do it. Yeah.
Okay. Very good. And I'm just gonna listen to your lungs one more time. I'm gonna have you sit forward for me again.
Okay.
Same as last time, okay?
Great.
Deep breaths. And again.
I know, but I'm still like, whoa.
Now the front. Deep breath. One more time. Very good. Now, before I go, is there anything else I can help you with?
No, I'm alright, thank you.
Excellent. It was nice working with you, and it was nice to meet you.
Thank you, you too.
Therapy was delivered at 10:30 a.m. on 11/16/15. The patient tolerated the treatment well. The vitals before the treatment were a heart rate of 105, respirations at 24, blood pressure of 115/72, and SpO2 of 94%. After the treatment, the heart rate was 102, respirations of 22, blood pressure of 115/72, and an SpO2 of 95%. Crackles were heard over both lower lobes of the lungs. The patient coughed up small amounts of thick white mucus. The patient was also informed about the importance of rinsing out your mouth after a corticosteroid treatment.